Hi, I'm Martin Godelie. I'm a family physician. I've been here in the Norfolk area for about 15 years. I started working here as a family doctor and working in the hospital here in town. And then about 10 years ago, became involved with the palliative care program, initially through the Haldimand Hospice in Brantford, because that was our closest center for palliative care. And I've been working with them doing outreach in the community. So we have palliative care at the hospital. Obviously, we have a couple of beds there, but hospitals aren't the ideal place to have end-of-life care. And so we have been going out into the community. We make home visits and we care for people with their families around them. We go into their home, we work with the nurses in the community, we work with grief and bereavement support in the community, and we try to keep people at home living their best life as long as we possibly can. The Norfolk Haldimand Hospice is basically the same idea as what we already have in the community, but expanding it for our area. So like every part of the healthcare system right now, we're strapped, we're short of people, and people in rural communities unfortunately often have to go places to receive the care that they need. Ideally, we like to keep people home. We like to give them the care that they want at home, and that's where people want to be. Even for end of life, most people want to be in their own homes. So we certainly want to expand our services in this area through outreach and grief and bereavement support so that we can support people at home. But in some cases, it's just not feasible for whatever reason, whether there's mobility issues or whether the family is aging as well and can't provide, some care. And so we want to have something close to home that's convenient for family, that's in the home environment. We have a beautiful county. Why wouldn't people want to stay here? And so we hope to build a residential hospice here that is accessible for people, is familiar for people. They look out the window and they see their home. Obviously, over the years, I think a lot of the cases have melded into one, and I've seen it time and time again. But I've certainly had older people who have, been farmers, for instance, in this community. An older gentleman who has been on the same farm. I had one person who actually was born in the farmhouse that they were living in, and we went out to the farmhouse and we saw them there. Their kids had moved home to help to take care of them, and so in that scenario we were able to keep them in their home. So they were born and they died in the same location, and that's pretty amazing to be able to offer people. At the same time, we've had people that, again, as I say, sometimes for whatever reason you can't keep them at home. I had an elderly couple that I was taking care of, and he had a terminal diagnosis and was dying, and she just wasn't physically able to support him at home, but it was really important for her to be close to him. The family were able to help her to get up to the Brantford Hospice, was where he went. And we had a room that was private. It had a nice view of the garden there. They had everything that they needed. The family could come and visit, and they had, access to the kitchen and everything. And she actually stayed right with him in the room. And so they were able to stay together right to the end. And at the end of his life, she actually crawled right into the bed with him and was laying right next to him when he passed away. And those are beautiful things to be able to give people. And it's such an honor to be able to be part of that care. And so we want to bring that here. We want people to be able to access that. To having a hospice in our community and in a familiar place, I think is ideal. And again, families are really good usually about, driving up to Brantford, but it's still 45 minutes and that's a long ways away, and it feels like people are going elsewhere for care. And we want people to be able to have their care where they grew up, where they worked, where their friends are. Because sometimes there's other people who are involved who can't make those drives. So having it close to home, I think, is important and the ideal. So that's what the Norfolk Haldimand Community Hospice hopefully will be, is that center right here, right in our area. We have an active board right now. We have programming that's already in place, and we're starting to grow. We're looking at grants that are available to us. We're looking at supporting people in terms of planning for end of life. We have a Facebook page that people can access. We're working on our website, which hopefully will be up and running very shortly. And our goal is a 6 to 10 bed residential hospice right here in Haldimand, Norfolk, that's available for our people.